Thank you.
I'm letting them know that right now. Jessica, she's not first? She does. I never told her she was first. I was holding out for Patrick. You're not on. Okay.
Hello, 1, 2, 3. Can you hear me?
I'm clear, Governor. We will, Maine Public, we will go right at the top of the hour at 2 o'clock.
This is my phone. Probably gonna go off as soon as. Oh, thank you.
You're still on mute, just so you know.
About 1 more minute.
April 20th.
Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm pleased to be joined this afternoon by Governor Mills, as well as Commissioner Jean Wambrew.
The
from
Maine
Maine's Department-
CDC holding
Department of
one
Health
of
and
its
Human
weekly
Services.
briefings on the COVID-19 situation across the state. Let's listen in.
We've got a bit of an audio issue. I think we've cleared that up. After 178 of these, it's not uncommon or unexpected to happen. But thank you all for joining. Again, I'm pleased to be joined by Governor Mills and Commissioner Wambrew from Maine DHHS. And we are delighted to be able to join you to provide an update on where we are with COVID-19 and where we're going to be going. I'll start by providing a quick snapshot of the public health side of things and then turn things over to Governor Mills before Commissioner Wambrew and the Governor and I take questions. And I begin, unfortunately, on a sad note. Since we last spoke, the Maine CDC has reported 5 additional deaths associated with COVID-19. The deaths were among individuals from across the state, from Cumberland, Kennebec, Oxford, Washington, and York counties. 2 were in their 70s and 3 were in their 80s. 1 was female, 4 were male. 2 of those 5 deaths were identified as part of our regular review of death certificates to make sure that we're not missing anything and have a full and complete picture. These deaths bring our total number of COVID-19 associated deaths in Maine now to 743. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of all of those who have been affected by COVID over the past year. Statewide right now, there are 50,787 cases of COVID-19, reflecting an increase of 283 cases since yesterday alone. Cumulatively, 1,677 people have been hospitalized, and right now in Maine, 74 people are in the hospital. 20 of them are in a critical care unit, and 5 are on a ventilator. Our positivity rate in Maine now stands at 2.43% for PCR tests and about 5.5% for antigen tests. In terms of our progress around vaccinations, cumulatively, Maine has, as a state, administered 712,798 doses of COVID-19 vaccine. 435,000 of those are first doses, and about 277,000 of those are among individuals who have now gotten both of their Pfizer or Moderna vaccines, or have gotten their single dose of J&J vaccine. Yesterday in particular was a big day for vaccinations in Maine. We administered over 20,000 shots in arms as a state, the highest number of shots in arms that we've administered since we began vaccinating for COVID. Way to go, Maine. That is great progress. And finally, before I turn things over to Governor Mills, I'd like to provide an update on a story that you may have heard about involving Johnson & Johnson vaccine. Yesterday evening, it was reported that some of the Johnson & Johnson vaccine that was in the process of being manufactured at a facility in Baltimore had to be thrown out. This occurred over the last several weeks. This, of course, raises immediate and concerning questions about the supply of Johnson & Johnson, its safety, and what it might mean for the future. Since that news broke, I've had the opportunity to speak personally with some of our federal partners to make sure that I had all the facts. And here's the bottom line. Maine will still receive our allocation of 20,600 doses of J&J vaccine for statewide distribution coming into our state next week. The doses that will be coming into Maine as part of this allocation were made in an entirely different facility, a facility not affected by this production issue. That means that the vaccine coming into the state next week and the vaccine that has come into the state already is safe, effective, and ready to go. To put that in perspective, I personally would not have any hesitation whatsoever about taking a shot of the J&J vaccine, either the vaccine that's already come into the state or the vaccine that will soon be coming into the state. It is as safe and as effective as it ever has been. So with that, I would like to turn things over to Governor Mills.
Thank you, Dr. Shah. And I'm so pleased that we hit that high note yesterday with more than 20,000 shots in arms. That's incredible progress. Back in February, with a limited supply of vaccine and with the dual goal of saving lives of people who are most at risk of dying or getting very sick from COVID-19 and getting shots in arms into arms as quickly as possible, we adopted this age-based approach to vaccine eligibility. Under that plan, we had planned to vaccinate Maine residents 60 and older in March, 50 and older in April, 40 and older in May, 30 and older in June, 29 and younger in July. Well, since then, and thanks to an increase in vaccine supply from the Biden administration, and as a result of the good work of the teams at Maine Department of Health and Human Services, Maine CDC, and our extraordinary healthcare providers and volunteers working around the clock, we've been able to speed up that timeline twice now. To date, more than 420,000 Maine people have received their first dose of vaccine, nearly 32% of our population, total population, with nearly 20% being now fully vaccinated. 59% of Maine people 50 and above, 50 and older, have received their first dose, with nearly 36% being fully vaccinated. I want to thank all Maine people who have already gotten vaccinated for taking this important step to protect themselves, protect their loved ones and their communities. So today, there I am. Today, just 9 days after we most recently expanded eligibility for the vaccines, I'm announcing today that we will speed up our vaccination timeline again. So starting next Wednesday, April 7th, all Maine residents ages 16 and older will be eligible for the COVID-19 vaccines. Now, only the Pfizer vaccine is authorized for people ages 16 and 17. That's that's the one that's been tested for that age group for now. And consent from a parent or legal guardian would be required for them. But everyone else will be able to be vaccinated at any of the nearly 200 vaccination sites across the state. This acceleration of our timeline beats by almost a month President Biden's original goal of making all Americans eligible by May 1st. And it comes as we receive a significant increase in vaccine supply from the federal government. This is good news, I think, and we should all celebrate the progress we're making. But to be clear, the change also means it'll take time to get appointments and to get shots into arms, so be patient. But some vaccination sites may start to accept appointments for eligible residents immediately, while others may take some time to prepare to offer appointments in the coming days. So we're giving them a couple days lead time to get ready. I want to emphasize that your continued patience is very important. To help make vaccines more accessible for people as we expand eligibility, we're allocating vaccines to providers in rural and hard to reach communities, and we're continuing our work to expand the number of large-scale vaccination sites. The Department of Health and Human Services is also allocating doses to cancer centers, dialysis centers, federally qualified health centers, and to others to prioritize those who are most at risk of harm from COVID-19, including people with medical conditions or disabilities, older Maine people, homebound, those who live in marginalized and medically underserved areas in Maine. So far, Maine is doing pretty well getting shots into arms. Right now, we are 4th best in the nation for the percentage of our population having at least one dose of vaccine, and 7th best in the nation for the percentage of our population fully vaccinated. And despite having the oldest population of any state in the country, older people being much more at risk of serious illness or death, despite that, Maine has the 3rd lowest number of COVID-19 cases and 4th lowest number of COVID-19 deaths per capita in the country, according to the United States CDC. The pandemic is not over. Spring is here, but the pandemic is not over. For more than a year, Maine people have cared for one another with compassion and courage and rising to the challenges of our time. We're still in a race of vaccinations versus the variants. And the variants are here. They're in Western Maine, they're in Southern Maine, they're spreading to every region of the state, and they're more transmissible and potentially much more dangerous. So please get vaccinated and stick with the precautions that we've had all along, the precautions that have kept us safe so far. Keep your distance from others outside your immediate family. Remind everyone to wash their hands and wear a face covering. Doing all of this will help us stay healthy, help us get back to our normal conditions sooner than ever before. For information on where to get a vaccine or to pre-register to know when appointments are available, or get help traveling to and from a vaccine site, visit maine.gov/COVID-19/vaccines. If you don't have access to a computer or the internet, you can also call our community vaccination line at 1-888-445-4111. 1-888-445-4111. Together, we will get through this and get our state back on track. So thank you, Dr. Shah and Dr. Lambrou, Commissioner Lambrou, and I think we'd all be happy to take some questions.
Thank you very much, Governor. The first question for the afternoon goes to Patrick Whittle.
Thank you very much. A couple questions. Governor Mills, you sort of covered this already regarding advanced booking. But could you talk a little bit more about what the process of advanced booking is going to look like for residents who are coming eligible starting next week? What specific steps they should take to do that?
Sure, and I'm probably going to defer to Commissioner Lambrou and Dr. Shah, but it will depend on what sites are ready and available when. Different sites have different capacities, and of course they have to be staffed up. We rely so much on volunteers at many of these vaccination sites, other than the local pharmacies, basically. But I'll defer to them on that question some more.
Sure, I'll start, and then again, Commissioner Lambrou and I are happy to discuss that more, Patrick. The process won't be fundamentally different. It's just that more people will be eligible, but it's not as if there will be a new architecture in place. There are different options based on where you live, as the governor mentioned. One option among all of them is to pre-register on the state site, but recognizing that that is only for the facilities that will ultimately be using that platform. Other vaccination sites in Maine also have pre-registration lists. For example, Maine General maintains one, so on and so forth. So there are different options based on where you'd like to go and where you'd like to be vaccinated. The process hasn't changed. It's just now that everyone will be eligible to take advantage of it.
Okay, terrific. There's also a little bit of news this week about one of the options I think has cleared a hurdle in the testing for teenagers, younger teenagers. Can anyone speak to that and what it means for Maine?
Yep, I'll just tackle that one really quickly, Patrick. In the immediate term, it doesn't have any implications for the short term or the announcement that we're making today. The data that were released by Pfizer were very encouraging. Indeed, those preliminary data, which I should note have not been published, have not been peer reviewed. It's all based on a press release, but those data suggested a stunningly high efficacy. It's very encouraging, but the US FDA has to properly review, analyze, and verify those results before they make any changes to the vaccine authorization for kids who are 12 to 15. We're still a ways away from that.
Is there any way to ballpark? Are we like months, a year? Could you even begin to guess?
I don't think it's a year, but I'm not sure within under a year what the time frame is. It really depends on the company's official submission of the data, how and when FDA prioritizes it, how the CDC evaluates it. I'm not sure what the timeline is, Patrick. It's less than a year, but within that, I'm not sure.
Okay, thank you very much for those answers.
Yep. Thanks, Patrick. Over to Jessica Piper next.
Thank you, Dr. Shaw. So first off, I know Governor Mills, you addressed giving vaccines to oncology clinics and places like that that could prioritize high-risk patients. I'm wondering if there are any instructions for other providers like pharmacies. Are they supposed to give the vaccine to any group in particular, or is it kind of a free-for-all at places like that?
I wouldn't call it a free-for-all, but you mean as of next Wednesday?
Yeah, as of next Wednesday, yeah.
As of next Wednesday, we would invite them to prioritize people with high-risk medical conditions, but frankly, or to schedule them according to their needs as well, because some people may be a little more hesitant to go to a public place because of an underlying condition. So that kind of thing we'll recommend. But Commissioner Landry, perhaps you have some other ideas?
Yeah, so I mean, the pharmacies are by definition large chains, they're across the state. Those are sites that are really accessible for almost anybody who can, again, get there. They're good for rural Maine, for example. They're really gonna expand our footprint. What we are working on, though, is a number of strategies to get at pockets of people to make sure that they have vaccine clinics where they are. So for example, our Office of Aging and Disability Services is working with parents of adults with developmental disabilities to see how would they like their children vaccinated. That may be in a drive-through in a region. It may be that we reserve one of our large throughput sites for a day for certain populations. We also, again, are going to look at those providers, large groups that deal with people with certain types of illnesses, offer them an opportunity to do special clinics. We will allow sites like, big group practices that know their own patients. As they go into this new age eligibility group, they have the choice of alerting certain of their patients that they may get access to appointments earlier than others, knowing that they may have some medical condition. So there's many different ways that we can ensure that while we're moving into this new eligibility group, we do so in a way that we're not leaving behind people who have high medical risk, as well as disabilities or other challenges getting a vaccine.
Thank you. And then where do college students fall in this eligibility in terms of residency if they maybe are from another state but are attending college here this spring?
So our definition of residency in Maine are people who live here, who intend to live here, who have an address, for example, that's in the state. That does include seasonal workers, it includes seasonal residents, and it does include people who live in Maine for higher education.
Thank you.
Over to Mal Leary next.
Thank you, Dr. Shaw. I'm not sure where, from what the governor said, I'm not sure where inmates in the prisons and the county jails rank in terms of priorities now that you're opening up to everyone over 16.
Sure, and I can answer that question as well. So as a reminder, we are moving into an eligibility group that is not restricted. Anybody who is authorized to get a vaccine under the FDA's authorization for the Pfizer and Moderna and Johnson & Johnson vaccine will be able to get one in Maine beginning on April 7th. We do continue to work with the Department of Corrections, who has already begun to vaccinate their age-eligible inmates. I know the Department of Corrections is also working with the county jails. The county jails themselves may also now work with other organizations in their communities, like federally qualified health centers, who have been interested in partnering with jails. So they are now part of the larger group, but obviously there needs to be special effort to vaccinate people in jails and prisons because they can't access the clinics like other people do.
But what priority is CDC setting for them to send the doses of whatever vaccine happens to be available to the county jails or to correctional facilities?
We continue our weekly process of looking at what do our large throughput sites need, what do our other hospitals, home health agencies to get homebound people. We're doing pop-up equity clinics next week. We want to make sure that they have vaccines. We're allocating to our FQHCs, And next week, we will be allocating to the Department of Corrections. So each week, we kind of look at the demand, we look at our supply, and we make those decisions. And it'll be on a rolling basis as, you know, Department of Corrections and county jails are ready to administer those shots.
And a question for the governor. You now have everyone over 16 eligibility question, but then the question becomes, are you going to further reduce some of the restrictions on gatherings, distance between where people go? You know, we have the raging battle in the schools of whether it's 3 feet or 6 feet. Do you plan to weigh in on that and set some priorities there?
We've already weighed in on many of those things, and the precautions that we set in place and the guidelines that we set in place over the last few weeks remain in effect. As I said, this is a battle between vaccinations and the variants. We want to make sure that the variants don't spread, that we limit the spread of those variants, and that means people getting vaccinated as quickly as possible. You know, we're making good progress. We're on a good path, but we're not there yet. And in terms of schools, we actually implemented the 3-foot rule long before the federal government actually adopted the same 3-foot rule, and that's still in place. We also purchased rapid test equipment for the schools across the state. We trained up learning facilitators to help kids in school learn when a teacher can teach remotely or doesn't feel comfortable coming into the classroom. I know there are physical space limitations still with many classrooms, but our schools have been open. They have been open this whole school year, and classrooms have been open for in-person learning. And I think we actually, our data, we look a lot better than most other states when it comes to in-classroom learning and availability of teaching in the classroom for students of all ages, particularly the elementary school ages. But we're doing what we can to facilitate learning at every level and every sort of learning, and to make sure that students and faculty and staff are all safe. And our statistics, I think, bear that out.
But what about those restrictions for the general public? Is it dependent upon this increased number of vaccines? At some point, you may make some changes there.
But, you know, it's always open to change, but we're looking at the case statistics, the death statistics, the hospitalization statistics. As you know, in the summer, we expect an influx of people. So we're taking it one step at a time. We selected the date of May 26th to open up things further, to allow for higher indoor and outdoor capacity limits for public-facing facilities. But we hope that those facilities and the organizers will take things very seriously, as they did last summer. And because of their cooperation, Maine became known as one of the safest states in the nation. And people are coming here now because they feel safe. And they're going to public-facing facilities and planning to have weddings and conferences and such, because they know that our precautions have helped keep their customers, their staff, and the general public safe.
Thank you.
Thanks, Mel. Over to Chris Costa at News Center next.
Hi, everyone. Can you hear me okay?
Yep, we sure can, Chris.
Great. Dr. Shah, I know you had addressed the situation at the Baltimore facility kind of off the top. Just one further question on that. Is there any idea if any future weeks after next shipment might potentially be affected by any of the issues in Baltimore?
Chris, your question cut out, but I believe it was whether subsequent weeks of production and supply will be affected by the Baltimore facility. Is that right?
Correct.
I spoke again with one of our federal partners earlier today, and we discussed this exact issue. Their assessment at this time was that the production issue that was uncovered would not affect subsequent shipments. This individual believed that J&J would continue to be able to meet its commitment of delivering 24 million vaccines nationwide in April. But I think right now what I understand is that they are assessing that. One important point, Chris, for everyone to be aware of, this facility was not yet producing vaccine. It was in the process of getting its FDA authorization to be able to be in the production game. That's why none of the vaccine that was the components of the vaccine that were being manufactured there, that's why they never actually entered the vaccine supply chain. The facility was still prepping to be part of that. It had not yet received the official certification from the FDA. And as part of its standard quality assurance, quality compliance process, this error was discovered. But in terms of what that means going forward, Chris, I think it's what I've been told is that it will not affect, but that's still under evaluation.
Okay, and thanks for that clarification. I appreciate it. We are obviously getting a sizable increase in Johnson & Johnson doses. Last week, I guess for this week, 8,100 doses, but for next week, it's an increase from that of 12,500 up to the 20,600 number you mentioned. I imagine this helps us a lot with many of the areas you all have spoken about the hard to reach places, rural areas. Your reaction when you noticed the sizable increase that Maine was receiving this week?
We were really overjoyed to see it. We've been making great progress in larger population centers across the state, recognizing that we needed to do more for rural, harder to reach areas. The Johnson & Johnson vaccine, in that respect, is a big step forward for us. It allows us to expand our reach in two ways. First, the geographic piece that you mentioned, counties that we've been concerned about, counties like Somerset, Oxford, more recently Franklin County, where we wanted to increase the availability of vaccine. The other way in which it helps us is not so much where a vaccine can go, but who can administer it. This vaccine, because it does not require the same storage requirements and only needs one shot, it means that we can have different and creative ways to administer it. For example, starting next week, and you'll see this on our allocation, we're getting a lot of vaccine into the hands of EMS clinicians who can stand up drive-through or pop-up type clinics. We're also providing a lot of vaccine to independent pharmacies that can do these similar pop-up clinics and reach places of the state that have been tougher to reach, places like Rangeley, places in that part of the state. So the vaccine not only expands where, but also who can administer it.
Understood. Is there any plan yet, or have you guys discussed activating CVS as part of the federal retail pharmacy partnership?
We have had those discussions, Chris. Our approach to activating federal retail partners to date has been to look for locations or chains that add something. We don't want to necessarily activate stores that put things in competition with one another when doses are so limited. And that's why the approach that we've taken has been to first focus on chains that add a location in an area where there's not other assets available. But now with the increase in doses, we understand that the federal government will be activating on their side all retail pharmacy chains. I don't know when that will go active. We're working with them to understand that date, but we learned yesterday that the federal government will, on their end, be activating all retail pharmacy options nationwide, CVS is included. I don't have any further details as to when that will go forth, but we understand that that's being activated on the federal side.
Okay. And then lastly, are you able to just give a reminder of the total number of people in the 16 to 49 age bracket that are becoming newly eligible, and then how many total people are now eligible age 16 and all the way over to 80? Sure.
So of those 16 to 49 who have not yet been vaccinated in any degree, that number, the newly eligible as of next Wednesday, is about 470,000 people as of this morning. We'll get you the exact number of the roll-up of everybody who is now eligible, but the newly eligible basically is now an additional 470,000 people, and we'll get you that other number in just a bit.
So I guess the last question there then, Dr. Shah, and you guys had mentioned this previously, that with 470,000 people newly eligible, I think currently under the 50 plus, we have about roughly 591,000 people that are currently eligible. This is almost a doubling. How does the state feel, given the increased supply from the government, that we can effectively get shots to all of these people before tourism season starts? Do you think that's a possibility?
I do, and I can start, but again, Governor and Commissioner, please weigh in. There are two things now, Chris, that are different from even just a few weeks ago. Number one, and critically, is the significantly increased supply. That is a really critical piece of this. But the other piece, Chris, is not just the supply of vaccine, but our ability to turn vaccines into vaccinations. That is to say the number of vaccine sites, the number of hours per day they're open, the number of days per week they're open, and the number of people they have at any one time administering shots. We've been working for weeks now with all of those sites in anticipation of the increase of vaccine supply that we're seeing, so that when this increase came in, we could convert it into shots in arms quickly. Those are the two things that are different now from a couple of weeks ago. We're getting more vaccine, and we've also increased that headroom between our ability to take vaccine and turn it into shots in arms. That's why we feel comfortable expanding eligibility in this manner.
Thank you
And
very much.
And I think the word has gotten out that these vaccines are simple and easy to administer, to be administered to. Word has gotten out from people who've been vaccinated, and they're telling their friends and family and neighbors and community members that it's a great thing to do. And so there'll be an increase in numbers lining up for the vaccine, but we also have more trained staff, people who've been volunteering and working at these vaccination clinics for now several months, and they're used to it. And it's a pretty smooth operation everywhere you go.
Thank you, everyone.
Thanks, Chris. Over to Amy Brown next.
Thanks, Dr. Shah. Governor Mills, I just want to follow up. I know I've asked Dr. Shah before when he has quoted or cited percentages, and I just want to be sure that when you're citing the percentage that 32% of the state population has received a first dose, are you including everyone or of those among just adults who are eligible?
I think I'm including the total population.
Okay, yeah, Dr. Shah's nodding yes. Okay, thank you. And Commissioner Lambrou, I think maybe at the last briefing or last week, you said that people should not be getting a bill for having received a vaccine, and we're still hearing from people who are. So what should they do if they do receive a bill?
You know, the Bureau of Insurance has a consumer program. If you look up the Maine Bureau of Insurance, you should be able to find out information on how consumers can get help if an insurance company is billing them or a provider is billing them. I will remind everybody, though, these are federally purchased vaccines. There is a requirement that all insurance companies pay for the administration of the vaccine. And for uninsured people, there's a federal program that will pay any vaccine provider for the vaccine administration. There should be nobody getting billed for a COVID-19 vaccine in Maine or in the nation.
Let me add, sometimes you get paperwork from an insurance company or from Medicare, for instance. It looks like a bill, but it's actually a statement, and that may be the case there. And whether it's a statement or a bill, you'll have a number to call if you have questions about that bill. And I would call that number. I would also call the place where you got vaccinated if there's some confusion there. So.
Right. This came from one of the largest providers in the state, so I imagine there are many other people who are receiving that as well. And then finally, Dr. Shah, someone has asked us to ask you whether or not this vaccine may help with other coronaviruses, including MERS and SARS, and maybe even the common cold.
It hasn't been studied, so it's difficult to know. There's a notion that it might, because those other viruses in the same family are very similar. But thankfully, and I think the really important point here, Amy, is that those other diseases that you mentioned, SARS, Middle Eastern Respiratory Syndrome, or MERS, are exceedingly rare. The SARS has been all but extinguished, and MERS only has a handful of cases per year. Now, as to the common cold, again, too early to tell. It would be great if it would, but as with so many scientific things, we need to study it to be able to say with certainty.
Thank you.
Let me turn it over to Brian Sullivan next.
Thank you, Dr. Shaw. I think exciting day. On Tuesday, we asked you a lot of questions about this specifically, so I just love to hear from all of you about the discussions you had. What changed in the last 48 hours that tipped the scale that made you decide this is the time to do this?
Well, I don't think it was just 48 hours, but for my part, I have weekly conversations with the White House COVID folks, COVID team, and often including Dr. Fauci, Dr. Walensky, Jeff Zients, the head of the COVID response team. And they've been very blunt with us with what they can do and what they can't do. And if they think that, and they've made commitments that they've followed through with. And I feel pretty comfortable depending on their word about what we're going to get for vaccines. I know Dr. Fauci and Commissioner Lambert have similar conversations with their counterparts at the federal level and with other states. And based on that experience and that expectation, I think we're justified in expanding the eligibility for vaccines for people of our state. And there's pressure to get people vaccinated, as I said. And as Dr. Shah has repeatedly said, we're in a race here with vaccines versus the variants. And I think opening it up to people of all ages makes sense. And we're very, very pleased with the results so far and the number of people who've been vaccinated, who are eligible to be vaccinated. And I think this will help our economy recover in due course as well.
So it would be what's in the pipeline coming, more vaccinations, not a lack of people signing up would be what you would point to as the catalyst?
Definitely. I think there's still demand, but I think we've succeeded in getting a pretty high percentage of those formerly and currently eligible vaccinated. So we want to proceed and make further progress.
And I have a viewer question for you, if you don't mind. I think it's probably for Dr. Shah. With the number of cases today, the viewer was wondering if any of the people who tested positive have been fully or partially vaccinated, and if any of these cases came from groups or clusters of the state of Maine.
Sure. So Brian, as to the latter, we're beginning our investigation into those cases now. That investigation process can take several days before we touch base with people, figure out where they've been and who they may have given it to. So I don't have that right now. But in terms of those who may have been vaccinated and then still gotten COVID, that has happened across the nation as well as in Maine, so-called breakthrough cases, of folks who have had more than that 14 days, but have nevertheless been tested for COVID. But here's what's interesting there, Brian. In the cases where that's happened, both in Maine and across the country, the experience that those folks have had with COVID has been extremely mild. In some cases in Maine, folks were tested because maybe they lived in a nursing home and were tested as part of the standard protocol, even though they had been vaccinated. And they came back positive, but they didn't even know they had COVID. They were completely asymptomatic. In other instances in Maine, folks have been completely vaccinated and then tested later on, and at most had maybe just a mild muscle ache or just a slight cough that only persisted for a day or so. The bottom line there is that the vaccine works at doing what it does. It keeps people out of the hospital, it keeps them off a ventilator, and it keeps them alive, even if they have a small chance of getting COVID later on. Really important to note that there have been millions of doses nationwide, over 700,000 doses in Maine that have been administered, and the number of these breakthrough cases, numbers very, very small compared to that.
Thank you.
Over to Mal Meyer next.
Thanks, Dr. Shah. My question, state data shows about 500,000 Mainers will be eligible in this final phase of the rollout. Are there any concerns that come with this?
The concerns that have already been expressed, probably, getting appointments, and pre-registering and that kind of thing. But we've dealt with a lot of logistical hurdles so far. And I think we've done pretty well. We're ready for this next stage.
And to prepare for it, we do continue, as we previously mentioned, to do not just more staff and more hours at existing sites, but more access points. We were talking about more pharmacy chains being activated. We're working with independent medical practices, primary care doctors, who may not have a lot of patients, but maybe they can take care of their patients who may not otherwise get vaccinated. We're looking at emergency departments, as Dr. Shah mentioned, pop-up clinics done by EMS, potentially new large throughput sites, as well as a potential mobile unit so we can move vaccine clinics to parts of the state that need it. So we will both try to push out those additional sites as well as make sure we're not leaving people behind with these specialized efforts to get at homebound people, people with disabilities, people at medical risk, people who otherwise can't get to a vaccine clinic.
And this was a big point that you made earlier this week, Dr. Shah. What do you say to those who are currently age eligible now who have still not signed up to get vaccinated?
I think what I indicated on Tuesday still applies, which is now is your time. We've got a lot of vaccine in the state this week. There's a lot more vaccine coming next week. I wouldn't hesitate another day or another minute to go online, find an appointment, and book it.
And follow up to your point about CVS potentially coming online at some point. I know that you said that you didn't know when that would happen. Retailers like Hannaford, Walgreens, Walmart no longer have to prioritize school staff and childcare workers. Do you anticipate this helping parts of Maine that have fallen behind in their vaccination rates?
It absolutely will. As mentioned a moment ago, one of the reasons we chose the earlier federal vaccine retail partners that we did was because of their strong presence in parts of the state where we wanted to make access as easy as possible in Somerset, Franklin, Oxford County. Their expanded hours, as well as, their expanded supply of vaccine, as well as their geographic location, makes this a great opportunity for folks in those parts of the state where we are trying to get as much vaccine to, so they can they can have as equal access.
And my last question, sorry, unless somebody else wanted to chime in there. Is there any update about when the state's registration portion of its website will be up and running? Will it be ready before next Wednesday?
The intention is for it to be ready for those providers who have signaled their desire to use it. So again, not all providers have opted to use it, but for those providers who needed a registration solution, we are hoping to have it up and running in very, very soon. The goal is next week.
Thank you.
Over to Megan at WMTW next.
Thanks for taking my question. First, it's probably more of a clarification. In terms of the Department of Corrections and their allotment of vaccine, are the jails and prisons to go on their own to secure vaccine through partnerships with groups to get people who are incarcerated vaccinated, or does the state disperse the vaccinations, the doses to the jails?
So Megan, the way that we've been working with the Department of Corrections is that we at DHHS make allocations to the Department of Corrections for their use in state prisons, as well as to work with county jails to get doses to the county jails themselves.
Okay, and will there be increased doses going forward? I mean, because we were just talking about an increase of supply, so there was 100 doses of J&J received, and the largest jail got 11 this week. So just question in terms of, if supplies going up, will the DOC be getting more?
We anticipate that they will. That's our intention. We've got to make sure that they are ready to receive those doses. We've got to make sure at the county jail level, they've got a plan in place to administer those. And then at the state prison, at DOC side, to make sure that they are ready to take them as well. Again, our intention is to keep moving along that process. This just expands who is eligible. It doesn't change our approach. We've got that process in place now.
Okay, and just one other question about the expansion of the rollout, that announcement today. Is there any particular thinking as to why it, wasn't just moving to 40 plus to the next decade versus going to 16 and up? Meaning, what was sort of the decision making behind doing that? 470,000 people all at once. Is it about the resources? Is it that the 50 plus folks didn't heed your call to make their appointments? What if you could kind of clarify what happened in the room when you made those decisions?
Megan, I think I said earlier that about 59% of Maine people 50 and older have been vaccinated at least once, and nearly 36% have been fully vaccinated. And when you get to below 50, you're talking about a large group of people, but they're more or less at a similar risk level than people over 52, I think it's safe to say. And so we want to get as many shots in arms as possible. It's not that anybody's been hesitant. It's not that any age group has had less of an appetite for getting vaccinated than any other. We're anxious and eager to get this all behind us. We're eager to get shots in arms. we're eager to get as many people at the vaccination sites as possible. And with the number of vaccination sites that we've got now, and with the increased supply from the federal government and the federal retail pharmacy program, we're delighted to be able to do this and open it up to everybody 16 and over.
If I could amplify what the governor just mentioned, Megan, that point about supply can't be understated. When we opened up to earlier age tiers from 70 to 60 and then 60 to 50, each move added on the order of 180 to 200,000 individuals in Maine. And that was at a time when, as a state, every week, we were getting on the order of, including the pharmacy program and allocations to community health centers, anywhere from 26 to 38,000 doses as an entire state. But now we are getting on the order of 91,000 plus doses every single week, a significant difference from when we moved to prior age tiers. That allows us to open up to more people, coupled with the note that I made earlier about ever expanded capacity to administer those. That's why we can accommodate more folks at once. That does not mean that there will be no waits. It will be a challenge to get an appointment. Make no mistake. We're asking for your patience in this, but we thought it was worthwhile to open up that eligibility to start getting folks in the system.
And I would just add that, as a reminder, President Biden has said that they will procure enough doses for all Americans by May 1. So we are a little ahead of that schedule, not a lot ahead of that schedule, and we're not the only state who has, number one, as Dr. Shaw said earlier, done pretty well at getting those doses into arms, but number two, has recognized the opportunity and recognized the ability for us to move to this next level. Again, there'll be some challenges, but we're prepared both to do that large throughput as well as try to make sure that those at-risk populations and vulnerable populations get their doses as well.
I just asked one more thing. The 20,000 shots in arms yesterday was a pretty impressive mark. The highest number, I guess, in since we started giving vaccines. How did that come to pass? It was like a perfect storm, or was it just, it happened to be that? How did we do that? How did we accomplish that yesterday?
I think it was a couple of things. It was, gosh, this is the theme for today: more vaccine plus more capacity. We got a lot more vaccine coming into the state this week. We expect to get even more next week. And then for weeks now, Commissioner Lambrou and I have been meeting with and working with vaccination sites to ask them, how much more can you do? If you're doing 1,000 a day, what can you do to get to 2,000 a day? If you're doing 2,000 a day, what can you do to get to 4,000 a day? And we've been working with them. If they needed staff, we got them staff or volunteers, et cetera. And so I think yesterday we saw the fruits of that work. No, I mean, the real way that this happened was that those providers made it happen. The hospitals, the vaccinators, the volunteers who are staffing and operating those clinics, they're the ones ultimately who took that vaccine and turned it into vaccinations. They're the ones who get the credit for giving us a big day yesterday. Let's hope it's just the first of many.
Yeah, and I'm just going to say that I think this is not a surprise or a perfect storm. This is just the beginning.
Yeah.
We have still many sites that are saying, give us more doses. We can do it. We have teams ready to go. So we don't think this is a fluke. We don't think this is a one time. We think this is the first of many of these days that will hopefully accelerate over the coming month.
Mm-hmm.
I think word is getting out with the help of the media here present and others. You're interviewing people at vaccination sites, and people are seeing the joy in the eyes of folks who've been vaccinated, and word gets out. And it's easier getting out of the house right now. I mean, it is spring, even though it's mud season. You know, it's easy to get around, and people are less hesitant to go out when it's snowing and whatnot. And we started out back in December, what was like 12 or 13,000 doses a week, I think, and then doubled that in early March, late February. And now this number of doses is a real blessing. We welcome it. That combination of things is helping us get shots in arms.
Thank you all.
Thanks, Megan. Over to Evan Pop next.
Hey, Dr. Shaw, thank you. There was a report recently released by the University of Texas that rates each state's COVID data transparency in corrections facilities. And Maine received a D- grade for data transparency in the prison system, a D for juvenile facilities, and an F in the jail system. The report acknowledged that, at least for prisons and juvenile facilities in Maine, there is some COVID information being released, but said more needs to be done, including information on demographics of cases, hospitalizations, and vaccination effort. So I'm wondering, do you think that type of information needs to be put out there? And is there a plan to work with correctional facilities to do so?
I haven't reviewed that report, but I will certainly try to do so. It would be interesting to see what data they are seeking that have not been put forth. But for the specifics, I would defer or refer you to the DOC on that.
Okay.
the county
Sorry, go ahead.
who are independent of the DOC, of course.
I'm sorry, I missed that part. Could you repeat that?
And to the county jails who are independent of the DOC.
Right. So specifically, they're kind of looking for just expanded data beyond cases, number of cases, and number of tests. That's what the report is citing as more complete data. So I don't know if you have any comment on that, but
I have not reviewed the report.
okay. And the second question is for you, Governor Mills. A judge ruled this week in New York that state must immediately begin offering COVID vaccines to all people who are incarcerated. And in that ruling, the judge wrote that state officials in New York had, quote, irrationally distinguished between incarcerated people who are living, between incarcerated people and people who are living in every other type of adult congregate facility, and that there was no acceptable excuse for that deliberate exclusion. And I'm wondering if that ruling gives you any pause about Maine's policy of having not specifically prioritized people who are incarcerated for vaccination.
Excuse me, Evan, there's a big difference between not prioritizing or not prioritizing somebody versus excluding somebody. I haven't read the decision, but what you cited was that New York excluded inmates. We have not excluded them.
Right, but I think the decision is saying that they have to be specifically prioritized now, and that everyone has to be eligible. And until very recently, that wasn't the case in Maine, or until next week, it won't be the case because it will be expanded.
I think we've answered the question about inmates. They are being vaccinated.
So you intend to go along the same course in terms of that, in terms of incarcerated people, to make them eligible next week.
They are eligible.
Right. Sorry. Let me be more precise. To make everyone who falls within the age category that's becoming eligible next week.
They are not excluded, therefore they are eligible.
Great. Thank you.
Thanks, Evan. And the final question for the afternoon goes to Joe Lawler.
Yes, hi. Thanks for taking our questions today. So my first question is just a clarification. Dr. Shaw, I think you said 91,000 shots every single week going forward. I believe this week was around 70,000, and unless there's a huge increase next week in the federal retail pharmacy, will be around the same amount, or there's some shots coming from doses coming from other places that I'm not aware of. Can you clarify?
Yeah, Joe, I think I may have misspoken. I think I was looking at the wrong column here. You're right. So this current week, the week that we are in, the total number of shots coming into the state is about 72,000. That includes not just the state allocation, but also the allocation to retail pharmacies, as well as that to federally qualified health centers. Next week, we don't have the complete picture yet. We have the state picture. That is the 54,790. We don't usually learn of the pharmacy and the FQHC piece until the weekend, until Saturday or Sunday. That's when that's posted. We have been told, however, that the allocations to the pharmacy program in particular for next week will be commensurately large. I don't have the final number on that, but we'll find out usually on Saturday or Sunday.
And as we put in the press release, if that doesn't increase, we will be at about 81,000. So we kind of like assume it's not going down for now. But again, we were very pleasantly surprised last weekend when we learned that the number of doses going to the retail pharmacy program doubled. So that too could happen. So again, we're cautiously optimistic that we'll be in that ballpark of at least 80,000 doses next week.
So
indeed, Joe, and I know you track this stuff pretty assiduously. Indeed, we heard last night or got that the amount of vaccine being distributed to the federal program, the amount of J&J being distributed to the retail pharmacy program will track what was sent to states. That is to say, we are anticipating in the ballpark of around 20,000 doses of J&J going to pharmacies in Maine alone. That's not confirmed yet, but that's what our planning assumption is.
Okay, just to make sure I'm 100% clear. So about 20,000 J&J to pharmacies next year in the retail pharmacy. And then on top of that, whatever Pfizer and Moderna.
Correct. Correct.
That's right. Okay, yeah, that could be a very big increase then next week.
Indeed.
So
And don't forget that the F2HCs also get their own separate allocation. So this week they got 2,500 top of the state allocation.
got it. Thank you. I have a question from the Lewiston Sun Journal. They were noticing that allocations to the Auburn Mall CMHC have been pretty flat. Can you explain that? And do you think that mass vaccination site will start to get more doses in the coming weeks? And then also, I heard you say you're planning more mass vaccination sites. Do you have an estimate for how many new ones will be opening up soon and in what regions?
Sure. I'll speak to the allocation that's been going to our colleagues over at the Auburn Mall. You know, we've held most of the large scale vaccination sites have been getting about the same amount. That holds true for the Auburn Mall site as well. It's been getting 2 trays of Pfizer pretty steadily. That's 2,340 first doses, and those are coupled with the same number of second doses. Our understanding of their throughput there is about 4,000 per week. Now, we've been having conversations about whether they are able to increase that. If they can do more than 4,000 per week, such that they could use a whole nother tray of Pfizer, then we are standing by. But we've been working with them to make sure that what we allocate to them matches what they can do. I think it's also important to note, Joe, that that is not the only venue for vaccination in Lewiston or Auburn or in Androscoggin County. Last week and this week as well, we're providing vaccine to EMS clinicians there. Last week, as well as this week, to the Auburn Fire Department, as well as to United in Lewiston. So we're expanding who else is able to provide vaccinations there, to say nothing of the high number of retail pharmacies in the Lewiston and Auburn area, another opportunity for folks there. We're always keeping tabs on the data. And if Androscoggin County looks like it's not getting what it needs, we'll make sure we write that.
The part of my question on the more large scale vaccination sites, do you anticipate more and in what regions?
Yeah, in fact, well, Commissioner, I'll let you tackle that one.
I think the short answer is yes, we are considering more of these sites. We are looking hard at our geography because that's the way we really try to plan these large throughput sites. We don't have anything specific to announce today, but we do recognize that, you know, the population centers in Maine are the places to go for most of these sites. So we are considering Androscoggin County.
Let me add that we are considering working with the federal government on opening up a drive-through site too, and that may well be in Androscoggin County. I would like to see it in Lewiston. We're working on that.
Thank you. And my very last question is just simply, you know, with case counts increasing lately, what is driving the latest uptick in cases? Thanks.
Yeah, Joe, that is one of the various $64,000 questions out there. It's not a Maine specific question, it's a nationwide question. I've had conversations with colleagues across the country to compare notes on what we're seeing, as well as with colleagues at the US CDC. There are different moving pieces here, and I'm not sure which of them is accounting for which of these is the main driver, but the various moving pieces are, number one, and most likely, is increasing number of variants. Variants across the country have started accounting for a predominating share of COVID-19 cases, not in Maine, but in other states, Michigan and Florida most notably. The variants in question are more contagious, and sadly, they can sometimes even be more fatal or more serious. That's one piece. The other piece is there's more folks traveling. Data from airlines, credit card companies, et cetera, have all shown that nationwide, folks are out there more. They're out and about more, they're traveling more. That's certainly another piece of it. Now, again, which of those is really the main driver? That's what some epidemiologists across the country are trying to figure out, but those are the hypotheses that we're investigating right now. Thanks for that question, Joe. Governor, that was the last question for the afternoon, so I will turn things back over to you.
Oh, thank you. You know, we've been at this for about 3.5 months, I think, with this massive campaign to get vaccinations out to as many people as possible, as swiftly as possible, and to reduce the number of people dying of COVID-19 with COVID-19. And I think we're making great progress, but we can't let down our guard now. We're not in the last inning of this game. I'm pleased to see that Fenway Park is opening up. It's supposed to be opening today, but tomorrow because of rain, opening tomorrow. Soon the Sea Dogs will be opening. It's fishing season, it's mud season, it's spring in Maine. And for those celebrating Passover starting last Friday, I wish you a happy holidays. And those celebrating Easter this Sunday, I wish you also happy holidays. But don't give up and don't let down your guard. We're not through this yet. You know, when you're running a road race, you don't stop at the last 10 yards and say, well, I can walk this one now. You'll be overtaken. And we don't want to see that happen to the people of Maine and in this battle against COVID-19. We're getting there. We're getting there. We really, truly are. We can't let down our guard yet. And we want to have a vigorous tourist season, whether the cruise ships come or not, or whether the Canadian border is opening up. We're going to do whatever we can to encourage our economy to rebound. But we need help, the help of every person in Maine by following the precautions in place that will remain in place for now, and getting vaccinated as quickly as you can, wherever you can, whatever where vaccine is available, where you can go. So thank you to the people of Maine for your cooperation, your continued patience, and your courage. Happy spring.
Thank you very much, everyone. Have a good day.